So I'd like to thank the Alliance for having me here tonight for this Doc Talk. And also thank you all of you that came out tonight to listen to me speak. My name's Christy Huff. My background is in cardiology, and I'm currently director of Benzodiazepine Information Coalition. And I have lived experience with benzodiazepines. Briefly, I was prescribed Xanax in 2015, never took more than prescribed, but I developed physical dependence and severe interdose withdrawal pretty quickly and switched to Valium to taper off. It took me several years to taper off, and I was quite ill the whole time. Currently over 2 years benzodiazepine free, and while I'm doing much better than during my taper days, I still do experience symptoms consistent with protracted benzodiazepine withdrawal. During my taper, I became involved with Benzodiazepine Information Coalition, which is a nonprofit that was started by benzodiazepine harmed individuals in 2016 to help educate about the adverse effects of prescribed benzodiazepines. So tonight I will be talking about benzodiazepine tapering and managing withdrawal. There's a lot to cover, so this will be pretty general. And then we'll have a question and answer session at the end. So if you think of any questions along the way, something you'd like me to elaborate on, or share more of my lived experience, I'll be glad to do that at the end. Hunter gave you the disclaimer already about this not being medical advice. It does not substitute for talking with your own doctor and is getting professional medical care. And with that, we'll go ahead and get started. Okay, sorry, my slides are. So first off, this is a list of the current FDA-approved benzodiazepines and Z-drugs in the United States. They're listed by their generic names. Collectively, we call benzodiazepines and Z-drugs BZRAs, or benzodiazepine receptor agonists. So if you hear me, use the term BZRA tonight, then we're talking about both classes of drugs, which act very similarly and have some of the same adverse effects. Now, the most of the problems with these drugs is going to be related to physiologic dependence and not addiction, especially in this population that both the Alliance and BIC see in our daily work. Benzo withdrawal and injury symptoms are numerous. The Alliance actually has up to 140 symptoms listed on their website. When someone's experiencing withdrawal or injury, you're not necessarily going to experience all of these symptoms, and this is not a complete list on this slide, but I counted up to 80 symptoms during my own withdrawal. So it can be quite a bit, and they can be divided into either psychological or mental symptoms, neurophysiologic symptoms, or somatic symptoms. Somatic means body, and a lot of these are gastrointestinal type symptoms. Some of these symptoms are unexpected. Physicians don't necessarily expect them to be part of the benzodiazepine withdrawal syndrome. And unfortunately, often these symptoms can be misdiagnosed as other conditions. And benzodiazepine withdrawal can be quite confusing because it can appear in different patterns. The waves and windows pattern is actually quite common, and where you get a fluctuation in symptoms. And I definitely experienced that during my own tapering process. And even to this day, I can still occasionally run into waves of symptoms. So before you start on a benzodiazepine taper, and I'm assuming if you're here tonight, either you're thinking about tapering a benzodiazepine or in the middle of a taper, or maybe you're supporting a loved one who is. But the first question to ask is, why would you want to discontinue a BZRA? And the first one is loss of efficacy. You tend to develop tolerance to these medications over time, and they lose their effects. And using these medications long term actually can increase anxiety or worsen insomnia, basically the original condition for which the drug was being used. Next would be adverse reactions. I definitely experienced adverse reaction with my Innerdose withdrawal to Xanax, and it became apparent to me that the only way I was going to feel better is if I came off the medication. And then the last indication would be any use over 4 weeks. Definitely is a consideration for coming off the medication, because we know that adverse effects tend to increase over time. And there's just no good evidence for these drugs use, but beyond the 4-week point. So after you've decided you want to taper, first thing I recommend is to really do your research, because there's a lot of misinformation on this topic. I know when I was in medical school, I didn't receive a lot of training, and so you really have to be your own advocate as a patient. When I was going through this in 2015, all I really had was Benzo Buddies, which had a lot of good information, but it was a support website. And now we also have BIC, we have the Alliance, and also the Withdrawal Project. And so all of these websites are good places to look up information about the tapering process. And I will say, don't worry about necessarily writing all these down, because we will make these slides available to you on the Alliance website after this presentation. And after you do your research, you're going to ideally find a benzo-wise prescriber. And I know this is difficult. And I actually made a YouTube video on this not long ago, where I've shared 10 tips to finding medical help in this process. And also my coalition BIC has a list of doctors who have been recommended by other patients who are able to supervise a taper. This definitely should be a collaborative decision between you and your prescriber as far as how fast to go on the taper and what kind of taper that you want to do, and if you want to taper at all. The Alliance actually has a good set of tools on their website. The link is here, that allows you to take some pamphlets to your prescriber and really help educate them on the benzodiazepine issue. Informed consent, you're really only able to give true informed consent once you've been educated about this topic. And this is a form that can actually be used in clinical practice. I've left a link for that here. And then lastly, be thinking about, a support system, because a taper can be difficult. And so this can be your prescriber, your friends, your family, online support from the benzo groups. Sometimes it takes a lot of different people to help you out with the support. Okay. And then lastly, if you are experiencing Innerdose withdrawal, which is symptoms that occur between scheduled doses and are more common with short half-life BZRAs, then you're going to want to address that prior to starting a taper. So some people just dose their short half-life BZRA more frequently to take care of some of these Innerdose symptoms. But for me, my Xanax doses were only lasting 2 to 3 hours, and that wasn't really practical. So I ended up switching over to a longer half-life benzodiazepine. I specifically went on diazepam, but other people have also used clonazepam or chlordiazepam epoxide. Ashton, in her manual, she recommends diazepam, but again, not everybody tolerates that. So just know that there's other options available. When you're crossing over, it should be done in a stepwise approach. And Ashton actually describes this pretty well in her manual. So it's not a good idea to switch abruptly, because your body just needs to get used to the new medication. When you're converting between benzodiazepines, I just wanted to show you This table, it actually extends onto the next slide if you don't see your benzodiazepine here. But this is from Steve Wright's book chapter in the book called The Benzodiazepines Crisis. And we've got diazepam listed here as the reference dose. So it's the standard by which you're measuring all the other doses. And we have the Ashton equivalents on the left, and also values from clincalc.com. And you can see that there's a range here of equivalencies. And so I think the key point here is when you're switching benzodiazepines, you just want to get to equivalent dose where your withdrawal symptoms are either resolved or minimized before you start a taper. And as far as the actual dose, that's just going to vary between individuals. Okay, so as far as actual taper protocols and plans, let's talk about the Ashton Manual. This is the one that everybody talks about. This was published by Heather Ashton in 1999. This was her work from supervising a benzodiazepine withdrawal clinic in the 80s and 90s. It was revised in 2002, and then in 2011, she added a supplement. And it's a great start. There's a lot of good information there. But it's not complete. Not everybody can do the plan that she's outlined there. And in fact, I actually tried to follow her plan to the letter, and it didn't work out for me. I switched over to Valium. You know, that was great. I was feeling a lot better, and it removed my interdose symptoms. But after I started to reduce on her schedule, I couldn't handle it, and I had to go slower. So let's talk about general benzodiazepine tapering principles. No matter what taper you decide to embark on, there's some basic principles that apply. So you can consider tapering a cyclical process. Basically, you're going to make a reduction or a cut to your dose. It's wise to, especially when you're starting out, go under your first reduction less than 5%. And the support groups say keep things less than 5 to 10%. I know that when I was reducing, when I would get near the 7% mark on a dose reduction, I just couldn't tolerate any more than that. And so really you got to listen to your body on that. So once you cut, then you're going to monitor and hold until your symptoms stabilize. And then you're going to adjust based on what happened. So, you know, that first reduction I made, I reduced a milligram, and it was, you know, a lot of symptoms. So the next time around, after I stabilized, I reduced 0.5 milligram of Valium. And after that, it was, you know, much more tolerable. Tapering is not a linear process. You can see this green curve on the right-hand side of the slide. It's more of a hyperbolic or exponential process in the sense that as you're cutting doses, as you progress in the taper, you're going to get smaller and smaller. Says here to avoid updosing, and in general, that's a good rule, although there may be times where you've just reduced too much or your symptoms are so severe and that may need to happen. So it's, like I said, it's a general rule, but there's always exceptions to the rule. So taper techniques, tapers can fit into two general categories. And when we're talking about terminology describing tapers, just know that it can get a little confusing, because if you go to the support groups, things are sometimes called by different names. And I'm just going to say, don't get too bogged down on that. You really just need to find an individualized plan for you, something that makes sense to you and is going to work for you. So like I said, don't get too bogged down on the terminology, but I think it's easy to conceptualize it either as a cut and hold or a micro taper. Cut and hold being kind of the traditional taper that we think of, where we cut 1% of the current dose and then hold it until symptoms are survived or till they subside. And, you know, this is easy because it can be accomplished with existing forms of the drug. But sometimes symptoms from these larger dose reductions can be more intense and people don't tolerate it. At that point, you might want to consider a micro taper where you're cutting on the level of micrograms and calculating your percent dose reduction monthly. And this allows for finer adjustment and symptom control. And but just know that this is an off-label method, not approved by the FDA, and it can be subject to issues with accuracy. And you may start out doing cut and hold like I did, and then when I got halfway through the taper, I decided I just couldn't handle these bigger reductions anymore, and so I switched over to the micro taper. So a taper, I consider it to be fluid. You can make adjustments as you go along. And these are the individual methods that you can use to accomplish these two techniques that I just described. The only thing that's considered FDA approved would be using commercial tablets or capsules, or the oral liquid like diazepam or lorazepam. They come in liquid formulations. If anything else that you do, I've put stars by them, that's going to be considered off-label. But so you can also, if you're simply doing cuts with a pill cutter, and only cutting along the scored line, that you can only do cut and hold. But if you, the rest of these techniques, you can either do cut and hold or also micro taper, depending on the size of your dose reductions. So again, your options are also compounded prescription. And if you're going to go that route, make sure you use a reputable compounding pharmacy. There's liquid titration where you're dissolving your pills in liquid and making reductions via syringe. There's using a precision scale, making cuts with a razor and nail file, and then weighing the pill so you get the desired weight. And that's what I use for the last half of my taper. Now, there's also tapering strips where there's a company in the Netherlands where you could get this. I don't know nobody who's done this, but it's an option. Apparently they ship to the United States, and you can get your tapered doses in strip packaging. And it just makes it easier so that you're not having to do a lot of complicated math. And I just wanted to show you this slide because, I talked about how some of the terminology is different. If you look at the tapering information on the Alliance's website, they categorize tapers as either a coarse taper, which I think is akin to the cut and hold method where you're making these bigger reductions, or a fine taper where you can make smaller reductions with a liquid solution. And then the ultra fine tapers would be more like the micro tapers, where you're either using a scale or the compounding pharmacy, or what they're calling kitchen chemistry, the liquid tapers where you're dissolving your pill and making these tiny reductions. A good note up at the top here is, we talked about substituting a long-acting benzodiazepine, and this is optional. If you're not having significant Innerdose withdrawal, then I don't think you necessarily need to do that. A lot of time it's just simpler to taper off the benzodiazepine you're already on. And it also can be done at any time. You may get partway through your taper and kind of hit a roadblock, and then some people may switch over to a long-acting at that time, and that's helpful for them. One of the precautions I just wanted to mention on this slide is try to keep your generic the same if possible, or if for some reason it changes, then you need to treat that like a cut or a dose reduction and hold. Or let's say you're switching tapering types, you're going to switch from pills to liquid formulation, then it's a good idea to hold and make sure that you're stabilized before you proceed further with the taper. And you can read further on the Alliance's website about some of their other tapering precautions. And I wanted to share some of my survival tips from my own lived experience, just as far as getting through the taper. Not everybody has as difficult a taper as I did. But it's, I think these tips are probably useful for anyone. First, you're going to want to spend time managing your symptoms. The way to do that is obviously manage your taper rate and speed. But unfortunately, there's times where you get into situations where, you can't really backtrack or adjust. And so you need to manage the symptoms you're having. And, a lot of the things that I did were non-pharmacologic options. Like I used a heating pad for sore muscles, or I had water for my dry mouth. But then I had other symptoms where, I required medication. I had a significant tachycardia, and I used a beta blocker to help with that, for example. Actually, Dr. Podesta gave a good doc talk on managing symptoms last month. So if you want to take a look at that, there's some good tips in there as well. Coping skills were so important in this. Specifically for me, I think distraction was the biggest one. And what was distracting for me might not be distracting for you. So you kind of have to find your own way with that. And, at my worst moments, it was just me surfing the web or watching a lot of Netflix. But then as I started to get a little better, especially post taper, I started very, very light exercise, and then deep breathing and meditation were always helpful as well to cope with some of these symptoms and kind of calm my central nervous system. Self-care is so important in this. It kind of goes with managing symptoms, but I think I mentioned this here because I just, I think there's a bit of guilt that comes along with this. And, I just think it's so important that you care for yourself in this process. And it's just the right thing to do and what your body needs during this process. Acceptance is also extremely important. I mean, there's just times where I did everything and, was still having symptoms, and I just had to accept that this is the way it was, going to be for now. And then finally, support was so important. Beyond my family, and, my family didn't always understand what I was going through. I found many other benzodiazepine survivors online. And, I would say the support groups can get a little negative sometimes. So I ended up making friends, and we would take the relationship offline, and we would just text and talk and support each other through the taper. And that was so helpful during this process. If you want to read more about my journey, I've left the link here for you. And then the next couple of slides are the Alliance's got a full set of tools to help you with withdrawal management. And just note that benzodiazepine withdrawal is an active process where you need to advocate for yourself, and you need to control the rate of the taper, not your prescriber. Your prescriber is there to ensure your safety and help minimize discomfort with any symptoms that you're having. I'm going to skip over this last part because we're running a little low on time. And then this last slide is a lot of the tools, that the Alliance have. I already told you about their prescriber information packet, and there's also a tapering document, a document about support, and then that link to Dr. Podesta's DocTalk about managing symptoms that I mentioned earlier. So this is talk is always dedicated to the benzodiazepine survivors who kept courage when we weren't listening. And of course, now I am a survivor. I am one of you. But there was a time before I went through this that I was never educated and had no idea this was going on. So it was truly a learning experience for me. And after I went through it, it was really why I felt called to do advocacy work. So it's right about 7:30. So we're going to go ahead and open it up for questions.